Okay, you can start now.
Chintan sir?
Yes, you can start now. You're live.
Okay. Good afternoon to one and all present here. I, Dr. Bunda Gujjar, working as Assistant Professor in Ahmedabad Physiotherapy College, Paro University, would like to welcome our speaker and one and all present here. Now let me introduce about our speaker. Our speaker is Dr. Chintan Parikh. He has done DPT from SSD Physiotherapy College, MS University, Baroda. He has done MPT from HND Gadwal Central University, Dehradun, Uttarakhand. He has done Diploma in Health and Nutrition from Indira Gandhi Open University, New Delhi. He has been lecturer at Changa, Charusat in 2014 and 15. He has been a lecturer at Tertiary University in 2015 and 16. He has been Assistant Professor at Bharti Maya College of Physiotherapy in Surat in 2016 and 17. He also has clinical experience at Spinex Physiotherapy and Rehabilitation Clinic at Surat. He has been working as sports physiotherapy in Sports Academy for Sports Authority of Gujarat in 2015 and 17. He has provided service as sports physiotherapist in various tournaments such as Khel Mahakumbh and Vadodara Marathon and many others. He has also published more than 5 articles in international journals, and currently he is working as a physiotherapist in Community Health Center, Cambridge. I welcome you, sir. Chintan, sir?
Yes. Am I audible?
Yes, sir. You can start, sir.
Yes. My screen is visible?
Yes, sir.
Okay. So, good afternoon, one and all. Am I audible?
Yes, sir.
Okay. Good afternoon, one and all the students and faculty members. It's my honor and privilege to talk in front of you. I am very much thankful to Dr. Gaurav J. Patel, sir, Principal, Ahmedabad Physiotherapy College, for inviting me to take this topic, that is exercise is medicine. I'm also thankful to Vrunda ma'am for my kind introduction. I'm also thankful to other faculty members and students for providing me this opportunity to talk in front of you. So let's start with the topic, that is exercise is medicine, physiotherapist perspective. Am I audible?
Yes, sir.
Okay, ma'am. Thank you. Now, what is the need of this topic? First, I want to highlight that thing. So exercise is medicine. I'm not talking that exercise is the only therapy to treat any disease, but exercise is adjunct to other normal therapy that is available to treat chronic illnesses. And what is our role as being a physiotherapist? We have to prescribe exercise in a scientific way so that patient can benefit it out of it, and ultimately we can help the patient. Now, objectives of my today's talk. First, we will see the difference between exercise versus physical activity, how it is different. Both are important for being healthy. Later on, we will see the health benefits of physical activity and physiological effects of exercise. Then we talk in brief about metabolic syndrome, hyperkinetic disease, And in the second part of my presentation, we will see the principle of exercise prescription, role of motivation, and the future scope of exercise is medicine. Let's get started with the first slide of the presentation. Physical activity and exercise. Who defines the physical activity as the any bodily movement that is produced by the skeletal muscle that requires energy? Who is explicit that term physical activity should not use be interchangeably with the exercise? So it is only the body movement that is produced by the skeletal muscle and with the help of energy. It is not structured, it is not planned, and it may not provide health benefit also. So what is exercise? Exercise is the subcategory of physical activity that is planned, structured, repetitive, and purposeful in the sense that provides improvement or maintenance of one or more component of physical fitness. So main aim of exercise is to get benefited, and you can improve your physical fitness, you can improve your cardiovascular endurance, you can improve your muscle strength, you can improve your balance, etc. with the help of exercise. Now, what is exercise medicine? Exercise medicine is the physical assessment and prescription of exercise specifically for the prevention and treatment of injury or illness. Recently, I came across with one physician. He advised his patient who is having type 2 diabetes mellitus. Now, he emphasized that along with the medication, you need to emphasize on diet and exercise for the prevention of type 2 diabetes mellitus, as well as for the treatment purpose, exercise is also useful. So this is how exercise is prescribed by our doctors also. And as a physio, we should prescribe it in a scientific manner. So it further facilitates other therapies. It acts as a catalyst for other therapies. And when we are talking about the current evidence that provides that it reverses the treatment related side effect and increase the quality and quantity of life in people with the cancer. So in cancer, again, it is helpful to reduce the side effect of the treatment like radiation or chemotherapy, and it increase the quality as well as quantity of the people with the cancer. Exercise and health. Physical inactivity has an astonishing harmful effects, and exercise is a powerful tool to both treat and prevent the chronic disease, obesity, as well as premature death. Why it is a powerful tool? Because it strengthens your system in the form of cardiovascular system, hormonal system, and your metabolism as well. There is a linear relationship between physical activity and health status. More amount of you are engaging in physical activity, more amount of health benefit you are getting from it. And there is association between disease and inactive life. Nowadays, chronic non-communicable disease are more prevalent in our society in the form of obesity, overweight, hypertension, type 2 diabetes mellitus, and obesity. And physical inactivity is the major health problem of our time, because we are spending a lot of time in front of screen, we are spending a lot of time on mobile, we are spending a lot of time on laptop as well. So physical inactivity affects all group of the people, right from poor people to the rich people, and ultimately affects the life of the people globally, not locally. Health burden of inactivity versus smoking. Now, the phrase is very known nowadays that sitting is a new smoking. Why sitting is a new smoking? Because one day of being inactive has roughly equivalent health burden to smoking 3 cigarettes. And so being inactive for 1 week, it is equivalent to smoking of pack of the cigarettes according to the Khan MK BJSM 2010. So if you are inactive, you are equivalent to the side effects that you are getting with smoking 3 cigarettes or a pack of cigarettes. That is what the slide is telling about the thing. Now, what Lancet journal says that in view of prevalence and global reach, health effects of physical inactivity is not affected to health, but it also have its consequences in the form of economical, environmental, and social consequences. Like you have to spend a lot of money being a physically inactive person, because you may prone to get type 2 diabetes mellitus, hypertension, cardiovascular disease, stroke, hip fractures. So you have other burden also along with the health consequences. Lancet 2016 says that it urges all the sectors of government and society to take immediate, bold action to help make the people active more desired, affordable, and accessible choice for all population of group. Why they are stressing on this? Because by 2050, more than 50% of USA population will become obese. So they are urging all the government sectors, society, NGOs to take immediate action about the role of exercise in daily routine. Now, a drug called exercise. Likewise, many medicine have their generic name. Exercise is also having its generic name in the form of physical activity. Other brand names are in the form of walking, jogging, hiking, rowing, etc. Likewise, medicine, it should be provided in the dosage, that is optimum is 150 minutes per week and 60 minutes per day in children. Initially, you should start with the low dose, so to prevent the harmful effects in the form of injury. Advised to start with the low dose and advance as tolerated. Later on, we will see the principles of exercise prescription, in which fit protocol is to be followed, in which frequency, intensity, time, and type we are discussing later on. So in which intensity should be started slowly. And apart from other drugs in which they are very contraindicated during pregnancy and lactation, while exercise is completely safe and good for mother and baby as well. Now, this is the chart, a drug called exercise dose response curve, which says that those who are doing less activity and those who are sedentary, they are having less amount of health benefit, and those who are doing high amount of activity, they are having good amount of health benefits. So you need to be mobile all the time. A drug called exercise. So many drugs are having side effects in the form of headache, nausea, vomiting, but drug called exercise have side effects in the positive manner, that is decrease in BP, blood sugar, pulse. It provides stronger muscle and bone. It helps in weight loss. It improves your confidence, self-esteem, and concentration. It improves your bowel and sleep habits. Adverse reaction, which is very rare. Sweating, mild sweating is there with the exercise, but it should not be in more amount. Injury. So injury you can prevent with the FIT protocol. And sudden death, which is extremely rare, and you can prevent that thing with the help of other physician. Ma'am, may I audible?
Yes, sir.
Okay. My pace is comfortable?
Yes, yes.
Okay, ma'am. Thank you. Administration, self-administration or with the help of others, in which physiotherapist role is very important, because we are the only person who prescribe exercise scientifically. Start off slowly, add minutes and intensity, depends upon the capacity of the particular person. Change the formulation to decrease the boredom and improve the compliance, and take outdoor as well as indoor activity to improve the physical activity and exercise of that particular person. Now, exercise is a wonder drug. physician should prescribe and patient should take. I came across one article in which they are saying that in abroad, like countries like USA, UK, Australia, in that countries, physicians should attend one lecture that is called Exercise is Medicine. So along with the medication, the doctors can prescribe exercise to their patient for their well-being. So that is the one finding I came across in one article. Now, physical inactivity and the sedentary lifestyle, you can see it is having paramount effect on all the systems, starting from cardiovascular disease. It may lead to cardiomyopathy, coronary heart disease, congestive heart failure, hypertension. If you are not physically that much active, you may suffer from musculoskeletal disorder in the form of low back pain, osteoarthritis, bone fracture, osteoporosis. You may suffer from psychological issue in the form of depression, mood swing, anxiety. You may suffer from pulmonary disease because your exercise carrying capacity, oxygen carrying capacity, it decreases. So it may lead to emphysema, chronic bronchitis, asthma. It may lead to certain type of cancer in the form of colon, prostate, lung, and breast cancer, and metabolic disease in the form of obesity, overweight, and diabetes. But in nutshell, exercise can prevent all the disease if you are following the scientific way of doing exercise. Now, health benefits of physical activity. So there are strong evidence that it lower the risk of dying prematurely because it strengthens all your systems, starting from your cardiovascular system to your musculoskeletal system, to your hormonal system, to your neurological system. It reduces the risk of coronary artery disease and stroke because it vasodilate your blood vessels. Type 2 diabetes, you can get the benefit by having decrease in the insulin resistance, increase in the insulin sensitivity. It decreases your high blood pressure, adverse blood lipid profile, colon, breast, lung, and endometrial cancers, and hip fractures. If you are doing weight-bearing activities, then you can prevent this type of incidents, and you can prevent it. You can prevent also from the hip replacement surgery. Now, there are somewhat less evidence in the form of it reduces the abdominal obesity, feeling of depression and anxiety, helps in weight loss, weight maintenance, and prevention of weight gain, prevention of falls, improve the functional health for the older adults. We will see later on that in older adults, along with the other exercise, you need to inculcate the balance activities. It improves the cognitive function because it releases very happy hormones from your brain. It increases your bone density and the connective tissue strength and improve the quality of sleep. Now, physiological changes induced by the cardiovascular endurance training. So first and foremost, in your cardiovascular system, it increases the heart size. So heart can pump more blood. It increases your stroke volume, cardiac output, VO2 max, and oxygen extraction from the blood, and lung volume. So you may have less chances of having pulmonary diseases in later stage of your life if you are physically active. Again, it reduces your blood pressure from the cardiovascular point of view. In musculoskeletal system, it increases the ATP production. So you are having more amount of energy and you feel less tired and less restlessness because mitochondrial number and size increases. Myoglobin and triglyceride storage is also increases with the help of exercise and physical activity. Other systems, strength of the connective tissue increases. Nowadays, we come across in our OPD that so many patients affected by the ligament injury. So that is also prevented with the scientific way of exercise. Bad cholesterol profile is totally changed with the help of exercise. We will later on see the case study also in which I planned an exercise plan for the lady who is having bad cholesterol, who is having hypertension, who is having blood sugar, increase in blood sugar. So that we will see later on. It improves your cognitive function. And nowadays there are trends that Alzheimer disease is on the rise. So what is the cause of that Alzheimer disease? The one cause is being physically inactive. So that is also prevented with the help of exercise. Now, exercise as medicine, it is having immediate effect, long-term effect, and it can be used for the prevention of the disease. So one such study says that exercise session of 50 to 75% of maximum intensity decreases this systolic blood pressure 18 to 20 mm of Hg and decrease the diastolic blood pressure by 7 to 9 mm of Hg. So you can see that single bout of exercise reduces the blood pressure drastically. And if you can prolong it for the several weeks, several months, then you can imagine what type of benefits that you are getting with the help of exercise. When we are talking about blood sugar, when you are doing exercises 55 to 75% of maximum intensity, blood sugar decreases by 20 to 40 milligram per deciliter. And it lasts for 2 to 3 days. So it is also very beneficial for the type 2 diabetes mellitus. This is the dose response relationship for health benefits and volume of physical activity. You can see that triglyceride level, high density lipoprotein level, and triglyceride level, they are improved with the more volume of physical activity. If you are doing more amount of exercise, then this thing is also improved. Now, before going for any exercise or being tested for any exercise stress test, you need to go for the comprehensive health evaluation. The first one is the PARQ, that is the Physical Activity Readiness Questionnaire. It is to determine the client's readiness for physical activity. It should be done by your physician. Checking of the signs and symptoms and medical clearance is required mainly to identify those who are at high risk. Coronary risk factor analysis, we will later on see that there are 7 factors which you need to assess before prescribing any kind of exercise or before exercise testing. Disease risk classification to categorize the person or the client as a low, moderate, or the high risk. Medical history should be checked. Personal history, family history should be checked before giving clearance for the exercise. Lifestyle evaluation, you may have so many questionnaire to find out the lifestyle related problem of the person, and you need to take the informed consent from the person and explain the procedure, purpose, risk, and benefits of the physical fitness. Now, coronary heart disease risk factor, the most important from physiotherapy point of view is the 8th one, that is the sedentary lifestyle. If you are not meeting the recommendation for 30 minutes of moderate intensity physical activity on at least 3 days per week, so you are not active or you are considered to be as a sedentary person. So that should be checked first and foremost, even in your day-to-day patient's evaluation, it should be included. And one such article I came across that says that exercise should be included as your vital sign. So along with your BP, heart rate, pulse rate, exercise should be incorporated as your one of the vital sign, and you should always check before prescribing any exercise to your patient. Other factors you may aware, that is age, more than 45 years if it is male. If it is woman, then it is more than 55 years of age. Family history, positive family history in the blood relationship, cigarette smoking, hypertension, dyslipidemia, and prediabetes and obesity. For obesity, again, we are having crucial role to identify the person who is obese. For that, we can take the help of waist circumference. if it is more than 102 centimeter in men and 88 centimeter in women, then it is considered as an obese person. Now, you may go through this. I will not go into detail of this hypertension, classification of hypertension. And stage 1 hypertension, stage 2 hypertension, pre-hypertension should be evaluated vigorously before going for any kind of exercise. Now, this is the ACSM, American College of Sports Medicine, recommendation for the current medical examination exercise testing prior to participation in physical fitness. So you can see that those who are having low risk and moderate risk does not require any evaluation from the physician. But those who are having high risk, they should be recommended for the physical evaluation before participating in any kind of exercise. For the submaximal test and maximal test, again, those who are at moderate or the high risk, they need to undergo physical evaluation and the medical evaluation under the physician. Now, what is physical fitness? Now, we are moving towards the second part of my presentation, that is the physical fitness. Physical fitness is the ability to perform the occupational, recreational, and the other daily activities without becoming unduly fatigued. And components, you may also aware that it is having 5 components: cardiorespiratory endurance, musculoskeletal fitness, body weight and body composition, flexibility, and the balance. Now, estimating exercise intensity. Before jump onto the principle of exercise prescription, we should check the intensity of the exercise, because in FIT protocol, I stands for intensity, and for intensity, you can do this test. I took this test specially mainly because you can do it at your clinic and even in your OPD. So first test available to check the intensity is the heart rate. You have to find out the maximum heart rate, that is 220 by age. If it is less than 50%, then it is considered to be a light exercise. And if it is more than 70%, it is considered to be as a vigorous exercise. Then second one is the talk test. If you can talk and sing, then it is of no use. The exercise is not useful for having health benefits. But for the vigorous kind of exercise, you can only say few words before pause for the breath. That is considered to be as a vigorous exercise. And bore grating for perceived exertion, it is again very useful in your clinical practice. If it is ranges between 9 to 11, very light and light, it is advisable that it should be prescribed in beginning level. For the moderate and the high level, it should be between 13 to 20 of the bore grating for perceived exertion. Now, these are the types of training and exercise modes for improving physical fitness component. For improvement of the cardiorespiratory endurance, you need to take the help of aerobic exercise in the form of walking, jogging, stair climbing, country skiing, step aerobics, etc. To improve the muscular strength and muscular endurance, you need to take the help of resistance exercise in the form of free weights, exercise machine, body weight exercise, exercise bands, that is TheraBand, TheraTube. If you want to improve your bone strength, then you need to take the help of weight bearing exercise, aerobic exercise, and resistance exercise in the form of walking, jogging, aerobic, stair climbing, country skiing, free weights, and weight machines. If you want to improve the body composition, you need to take the help of aerobic as well as resistance exercise. For flexibility, you need to take the help of stretching exercise in the form of PNF stretches, yoga, tai chi, pilates, and static stretches. For the improvement of balance training, you need to take the help of tai chi, yoga, pilates, and balance exercises. So classification of aerobic exercise and modalities. For the useful purpose, they are divided the aerobic exercise into 4 types. Type A, and this classification is based on the skill requirement and the level of physical fitness the person is having. So type A activities including cycling, walking, aquarobics, slow dancing, which requires minimum skill as well as minimal fitness. Activities that require average physical fitness but minimal skill, they are the jogging, running, rowing, etc. Type C activities require both skill and average physical fitness level. They are considered to be as aerobic dancing, bench step aerobics, Nordic skiing, swimming, etc. Type D activities, they are the recreational sports that should be prescribed only in addition to regular and the aerobic exercise program, such as the basketball, tennis, hiking, swimming, handball, etc. Now the metabolic syndrome and its consequences. We already learned the physical inactivity and the sedentary lifestyle and its consequences on different systems. So we will move further. Risk factor for the metabolic syndrome. From the physio point of view, it is very important. You need to assess the weight circumference, blood pressure measurement, fasting blood glucose level check before participation in any kind of exercise, because if it is having abnormal value, then you may get injury to that patient. Triglyceride level, HDL level should be assessed before going for any kind of vigorous or the moderate kind of exercise. Now, this is very important. Nowadays, we are using many apps that shows the pedometer, that is the number of steps per day. So what you are thinking, that if you are taking 7,500 steps per day, it is normal? No, the criteria suggests that if you are having more than 10,000 steps per day, then you should be considered as an active person. And highly active, it is more than 12,500. For the girls and boys, again, if it is more than 12,000, then girls should be considered as an active girl. And for boys, again, it is more than 15,000 steps per day, and the boy should be considered as an active boy. Now, examples of aerobic activities depends upon the intensity. It is divided into the moderate intensity and the vigorous intensity exercise. Moderate intensity. So example of moderate intensity in which we can talk but not sing. We already discussed that thing. Talk test, walking briskly, water aerobics, bicycling, tennis, ballroom dancing, general gardening. And vigorous intensity in the form of cycling, swimming, race walking, jogging, running, etc. Now, principles of exercise prescription. This is the very important from the physio point of view, because you need to take the help of FIT protocol to prescribe exercise to your patient. And first one is the frequency. How often should I exercise? That is how many days in a week, how many times in a day I need to do exercise. That is decided by your frequency. Intensity, how hard should I work? That is the intensity. Low, moderate, and high intensity exercises are there. Time, how long should my routine be? Per day, what time should be allotted? Per week, what time should be allotted? That should be decided with the help of time. And type, what modes of exercise do I use? Whether I use the home-based equipment or the gym-based equipment, or the indoor activities or the outdoor activities, etc. An interval training prescription to develop the aerobic endurance. This is the interval training program in which intensity increases, decreases as per the requirement, and sets, one set of exercise. Distance should be covered, that is almost 1 kilometer. Intensity should be 70 to 85% of VO2 max, and time should be 3 to 5 minutes, and rest interval is 2 minutes. So this is how you can prescribe exercise to improve your aerobic endurance with the help of interval training. Now, strength training modes. Again, we are having static strength, dynamic strength, and the isokinetic strength. For the static strength, we know how to measure. It is with the help of maximum voluntary isometric contraction. And for the dynamic, you need to take the help of constant resistance or the variable resistance. And for the isokinetic strength measurement, you need to take the help of isokinetic dynamometer. Now, ACSM guidelines for the resistance training for the healthy population. If you want to improve your muscle strength and muscle mass, then it should be 60 to 80% of your 1 RM. Now, what is 1 RM? 1 RM is the maximum weight that you can carry in one repetition. So if you can lift 100 kg of bench press, then it should be of 60 to 80 kg with the repetition of 2 to 4 sets, 2 to 4, 2 to 3 non-consecutive days per week, and for 8 to 10 times. Now, why it should be 2 to 3 non-consecutive days? Mainly because body needs to repair itself and it takes time for that thing, because muscle strength and muscle mass, they are having catabolic effect, and ultimately you can grow with the muscle mass with the help of anabolism. Muscle endurance, again, the intensity is totally changed, in which 50 to 55% of your 1 RM. Repetition is again not 2 to 4, but it is 15 to 25. So it should be more than 12. Then it is considered as a muscle endurance exercise, and set should be less than 2. And it is again 2 to 3 non-consecutive days per week and 8 to 10 repetitions. Now, this is the example of sample circuit resistant training program, in which you can take the numerous exercise in the form of bench press, bent knee curl up, leg extension, lateral pull down. Intensity should ranges between 40 to 55% of 1 RM, and frequency 3 days per week, and overload principle should be used. You all know that for resistance training, you need to take the help of overload principle as well as the progression you need to provide in this thing. Now, this is the prevalence of obesity among US adults aged 20 to 74. I already told you that it reaches 50% by 2030. This is the type of obesity. We will not go into detail of this. Obesity leads to various health consequences. We will not go into this. Now, this is the important slide. If you want to prescribe exercise for the weight loss, the frequency is 3 days per week. Intensity is not light, but it is moderate to high. Type A and type B aerobic activities, that is in the form of walking, running, jogging, it should be included. And time should be 30 to 45 minutes up to 8 weeks. It is very important that it should be carried out for the longer period of time to get the better result. Now, this is the guidelines for designing flexibility program. Mode should be static, dynamic, PNF, and the ballistic stretch. Number of exercise 10 to 12. Upper body stretch, lower body stretch, you can prescribe to your patient. Frequency minimum of 2 days per week. You can do it on a regular daily basis, but minimum 2 days per week is preferable. And mainly flexibility exercise are included in warm up and cool down. Now, intensity, slowly stretch the muscle to the position of mild discomfort. That is the intensity. Duration of the stretch, 10 to 30 seconds, 3 to 6 second contraction followed by 10 to 30 seconds of assisted stretching for the PNF stretching, and repetition 2 to 4 each exercise. So that total amount of time is 60 seconds. And total session is 50 to 30 minutes per session. Basically, we use flexibility exercise program for the warm up and the cool down. Recommendation for balance training program. You need to provide balance activities for older individuals. Those who are aged more than 60 years, geriatric population, we are using balance exercise along with the cardiorespiratory and the strength training, in which progressively increase the difficulty by changing in the base of support, such as 2-leg stance, semi-tandem stance, tandem stance, 1-leg stance, include dynamic movements that changes the center of gravity, such as tandem walking, circle turns. Displace the center of mass by stepping over the obstacle and balancing a rocket platform. Use the exercise that stress the postural muscle, such as the standing with the eye closed or standing on a foam pad. Prescribe the multifaceted activities such as in the form of Tai Chi and the yoga. Now, guidelines for designing balance training program for older adults. So you need to take the help of Tai Chi, Yoga, Pilates, equipment in the form of balance disc, foam pad, balance board, stability ball, computerized balance system, nowadays available in Advanced Center, Force platform. It's again available in the Academic Institute. Frequency 2 days per week. You can do it for 3 times per week, 4 times per week, depends upon the balance problem of the client. Time is 20 to 30 minutes per session, 3 to 8 sets, 20 to 40 seconds each set, and length of the program is 3 to 6 months, depending upon the exercise mode. Now, exercise prescription for improved health. Again, you need to take the help of aerobic exercise, and the minimum exercise time decided by your ACSM is 150 to 300 minutes per week, and it should be ranges between 3 to 6 minutes, and endurance type activities need to be included. Exercise prescription for individuals with the hypertension. Again, you need to rely on endurance type of activities followed by the resistance exercise. Moderate intensity of endurance and the resistance exercise should be included. Duration is 30 to 60 minutes. Minimum of 1 set of resistance training exercise for each muscle group is required, and frequency most preferably all days of the week of the aerobic exercise to be included. 2 or 3 days per week resistance training also included to improve the health condition those who are having hypertension. Exercise prescription for preserving bone health. You need to improve the osteoblastic activity, and for that you need to go for the weight bearing activities such as jumping, stair climbing, jogging, and frequency 3 to 5 times per week, 2 to 3 times per week for resistance exercise, and 30 to 60 minute day of combination of weight bearing endurance activities and activities that improve the jumping. And resistance training should be included that should target all the major muscle groups. Now, exercise prescription for the peak bone mass in children and adolescent people. So you need to take the help of impact activities in the form of gymnastic, plyometric, and jumping. Intensity is the high. Bone loading forces should be applied. Frequency 3 days per week. 20 to 30 minutes is the duration. Twice a day may be more effective, like morning and evening. Now, exercise prescription to prevent the cancer. So again, the most important thing, 150 minutes per week is not sufficient for providing the health benefit in cancer patient. You need to go for 210 to 420 minutes per week that is needed. ACSM guideline is not useful in prevention of your cancer. Now, this is the case. One patient previous week came to my OPD, who is having 55 years old, no complaint, but she shocked that she gained 10 kg since she showed me last year. Takes no medication. When we check her blood pressure, it falls 140 by 80, heart rate 80, height and weight you can see in this slide. Labs, FBS is 104, total cholesterol 192, triglyceride 110, HDL 50, and LDL 180. So what type of exercise you can prescribe in this patient? Can anyone tell me? Brunda ma'am?
Yes, sir. They can comment in comment box.
Yes, you can check the answer.
Yes.
What type of exercise we can prescribe to this kind of patient? One answer that is I am getting is the aerobic exercise. Excellent, you are right. You need to provide the aerobic exercise for such kind of patient. Don't go for resistance training initially in this patient. Now let's move further. So exercise frequency 3 times per week. Moderate intensity aerobic exercise should be included. Initially, time is not 30 minutes, but you need to start with the 15 minutes because all the parameters are on the higher side. So you need to start with the 15 minutes of exercise. Later on, you can increase to 20, 25, and 30 minutes of brisk walking. Now, strategies to increase the exercise program adherence. Now, the most difficult task being a physio is the exercise adherence by the patient. If you are not providing in a scientific way exercise prescription, then patient will not follow the exercise program. So what are the take-home message to increase the exercise adherence program? These are the few tips that you can use. You can recruit the physician support for the regular assessment of that patient. You should include the moderate intensity exercise initially. You can take the help of group exercise, offer a variety of enjoyable exercise, provide positive reinforcement through the periodic testing, recruit the support for the program from the clients, family, and the friends. Add optional recreational game, use the progress chart. There are so many questionnaires available to assess the physical activity, so you can record the exercise achievement. Provide a reward if he or she can achieve his or her goal. Provide a qualified exercise professional like us, physiotherapists, who are well-trained, innovative, and enthusiastic. Now, factors related to physical activity participation and exercise program adherence. So there are different categories, and positive factors and negative factors are there. We just discuss the positive factors such as the education, gender. If a person is more educated, then he can or she can follow your instruction easily. Enjoyment of exercise is there, then patient should love to do that exercise. Self-efficacy, self-motivation is there, then person can adhere to that exercise program. Support from the family member is again very important to reduce the weight of an obese person or to reduce the hypertension of an hypertensive patient. Access to exercise facilities, satisfaction with the exercise facility, exercise equipment at the home, enjoyable scenery outside at place that you are doing exercise, exercise leadership and supervision, variety of exercise modes and activities. This should be considered while you are prescribing exercise to your client. Now, what is the future scope of exercise medicine? Nowadays, many smart coaches are available. Fitness Build is also available, and there is various fitness app is also available. So you can track your physical activity in the form of heart rate, distance walked by you, your calories consumption during that physical activity. So the future is very bright for exercise medicine. Now, I want to quote from Hippocrates and Plato, what they are thinking in the past. All parts of the body, if used in moderation and exercised in labors to which each is accustomed, become thereby healthy and well developed and age slowly. So if you are active, then you can progress the aging process slowly. But if unused and left idle, they become liable to disease, defection in growth, and age quickly. According to the Plato, lack of activity destroys the good condition of every human being, while movement and methodical physical exercise save it and preserve it. These are my references. Thank you for your attention. Vrunda ma'am, I have done with my presentation.
Yes, sir. If anybody has any query, then they can write in the comment box. We will wait for 2 minutes. Then we will conclude it.
Okay, ma'am.
Okay, I guess no questions are there.
Okay, ma'am.
Thank you
One
so
question
much,
is
sir.
there. One question is
Yes.
there. Walking more than 10,000 steps. So yes, according to the new guidelines, you need to take more than 10,000 steps if you want to live a active life. Okay, ma'am.
Okay, sir. Thank you very much for your wonderful lecture. Thank you for sharing your insightful knowledge. We would like to hear you in the future for sure.
Okay. Thank you, ma'am. Thank you to Gaurav sir and the management of Paravali University.